Hi, I'm Dr. Sinan, GP and longevity doctor. Today, I thought it'd be fun to walk through the anxiety questionnaire that most doctors in the UK will use to diagnose someone with an anxiety disorder. The questionnaire that I'm going to walk through is something called the GAD-7. That stands for General Anxiety Disorder 7 score. The 7 part refers to the fact that the whole screening tool has 7 questions, and within that, it allows you to quantify the risk or the degree of anxiety disorder, or whether there is one or not, and it also allows you to monitor. So going forward, when you're assessing someone every month or every 3 months, you can repeat the questionnaire, look at the score, and see if things have improved or not. So again, this is a very common tool that's used in primary care. It's used in other outpatient settings like mental health also. And again, just to stress, it is a screening tool. It's not necessarily a diagnostic tool. So it tells us whether someone is likely to have anxiety. This screening tool gives us a lot of information. And again, it helps us to quantify. But a lot of the other useful information comes from examining the patient, getting the rest of the clinical history, clinical context, and patient's family history as well, and allow us to manage things going forward. The useful thing with this tool is that it is very sensitive. So it does answer the question that we're interested in. Does this person likely have an anxiety disorder? If so, is it mild, moderate, or severe? It certainly does that very well, and it does it quite quickly. It takes maybe 3 or 4 minutes to walk through the whole questionnaire and to have an objective, quantitative answer. It's also quite useful because it screens for a multitude of generalized anxiety disorders. So it doesn't just screen for one type of anxiety. It screens for the commonest types, one of which is actually called generalized anxiety disorder. Also screens for post-traumatic stress disorder, social phobia, and panic disorder, as well as a few other types of conditions. So let's crack on and walk through this tool. Again, just before we start, this is a tool that has been created and is a validated tool. So we know it works, and there's multiple studies to confirm that it does what we want it to do. The important thing is that it's been created for a clinician or for a healthcare professional to use with a patient. It's not a self-screening tool, so you shouldn't be using it yourself, going through it and saying, ooh, I have X, Y, and Z. Again, there is much more nuance and much more clinical context to understand what the actual diagnosis is, as well as what the appropriate treatment plan is. So the purpose of this discussion is just to give you an idea that this tool does exist. If someone starts asking you these questions, this is the tool that they're likely to be using in the context of anxiety. These are the types of questions that you may be asked. So you won't always be asked this. If you have anxiety and you see your healthcare professional, it may be that they're happy to go do a more generalized history and be comfortable with diagnosing an anxiety disorder, which is absolutely fine as well. You don't need to use these tools. They just help specifically to give a bit more of a grading from a mild, moderate, severe anxiety perspective, as well as quite useful when you're monitoring. But by no means are they kind of mandatory or definitely necessary in every situation. So the main purpose for this is just to give you an idea of what's going on from an educational perspective. So if you're in a position where you think you may have anxiety, you're welcome to have a flick through this online, but don't start self-diagnosing. Do speak to a qualified healthcare professional to walk through this test or alternative approach to understand exactly what's going on and consider next steps for your management and for whatever symptoms you suffer with. So let's walk through the tool. As I said, there's 7 questions. Each question has 4 possible answers, and each of those answers is graded as a 0, 1, 2, or 3 points. The maximum points you can get from 7 questions is 21. 21, the highest level, indicates the highest degree or the highest severity of anxiety, and vice versa. If you get 0, you're unlikely to have anxiety, and anything on that lower end of the spectrum, below 5, below 10, is likely to be a milder form of the disease. All of these questions should be framed within the context of symptoms that have occurred within the last couple of weeks. Yeah. So normally we would say, how often have you been bothered by these symptoms in the past few weeks, and start working through the question. So first question, how often have you been feeling nervous, anxious, or on edge? And then the options, not at all, several days of the last 2 weeks, more than a week of the last 2 weeks, and then nearly every day. I'm just going to say several days just so we can have an answer to play with at the end. Next question, not being able to cope or stop worrying. So let's say more than half the days. Are you worrying too much about different things? Do you have trouble relaxing? Have you found that you're being so restless that it's actually hard to sit still? So very fidgety, on edge, can't relax. Let's say more than half the days. And have you found yourself, or have other people found that you're becoming easily annoyed or more and more irritable? several days. And the last question, have you been feeling afraid as if something awful might happen? So that kind of indicates, again, more on this trajectory of fear and being on edge. Let's say several days. So that's it. Those are the 7 questions. And then we start to get a numerical total point score. Here we've got 9 points. There is an additional question which doesn't actually make up part of the quantitative final score. So it's not included in the score out of 21, but it is a generic, what we call a kind of global question. Gives us an idea as a snapshot of what's going on. And the question, it's also very similar for the same screening tool for depression. How difficult have these problems or have these symptoms related to anxiety made it related to your work, related to taking care of things at home, or getting along with other people? Gives an idea, an overview of how much this is affecting someone's life, which I always think is a really useful additional point. But again, it doesn't add anything to the final score. So in this instance, walking through, we've got 9 points out of a total 21, and that indicates mild anxiety disorder. We're actually on the threshold of mild anxiety and moderate anxiety disorder. So anything below 9, or actually 5 to 9 is a mild anxiety disorder. Anything below 5 is unlikely to be anxiety. A score of between 10 to 15 is moderate, and 15 and above is severe clinical anxiety, likely to warrant and need treatment. If you get a score in the kind of 5 to 9 range, which indicates minor, then often it's a case of monitoring and maybe some recommendations for things like exercise or tools that can help with anxiety and managing symptoms that you may be suffering day to day, such as mindfulness or meditation or yoga or breathing exercises, for example. If you've got more moderate or severe symptoms, again, depending on the specifics, depending on your other medical condition, depending on what is likely to be causing this, it may be appropriate to consider other interventions such as therapy and such as anti-anxiety medications. Again, these won't be appropriate for everybody, but often people will use both of these, tablet medication as well as cognitive behavioral therapy or an alternative form of therapy, depending on the specifics of the problem. Both would be appropriate from the evidence base. Again, it just depends on the specifics of the case. It just depends on the acceptability to the patient of taking either medication. Some people are really happy to take medication. They want something. They like the feel of a tablet. They understand that it's not going to solve everything, but it'll help them function better. Some people hate the thought of a tablet. They don't feel that these types of symptoms should be treated with a tablet, and they much prefer therapy. Some people don't like either. They don't want to wait for therapy. They don't want to do therapy. They hate the thought of therapy. And some people don't want to take medications, and they find alternative ways of managing it. The other thing as well that I haven't mentioned here is that there are other causes of anxiety that aren't just psychological. Anxiety itself is probably, if not the commonest, one of the top 3 commonest psychological disorders out there. There are physical causes that can cause symptoms of anxiety that are psychological and physical. So thyroid diseases, certain medications themselves can cause anxiety, as well as other conditions that may be related to the rate of the heart or irregular heart rhythm. So these types of things can sometimes cause symptoms that feel like anxiety. So it is important to get a physical check if you're presenting with anxiety for the first time. Otherwise, yeah, that's pretty much it. That's a walkthrough of the GAD-7 score. You can check it out online. This is a free tool that's available at mdcalc.com, MD Calculator. You can play around with this. But again, if you feel that you have symptoms, don't infer too much from the questionnaire itself. It's really the questionnaire or the screening tool in the context of your wider clinical history in the hands of a regulated healthcare professional. Many thanks for listening. Many thanks for watching. Please do click that subscribe button. Until next time, stay healthy.